Welcome back, everyone. Today, we're diving into a really critical challenge in modern medicine. Just how do you manage the immense, complex resources of a hospital? We're going to look at how artificial intelligence is stepping in to help, and really how it's starting to transform everything from patient flow all the way to a physician's daily workload. So let's just start with a statistic that honestly gets right to the heart of the problem. For every single hour a physician spends with a patient, they're spending 2 hours on paperwork. Think about that for a second. This isn't just about some minor inefficiency. This is about a system that is actively pulling clinicians away from their number one purpose, caring for patients. And that's the massive challenge we're going to tackle today. All right, so to understand how we get from that big problem to the solution, we'll break our discussion down into these 6 key areas. We'll start by looking at the overloaded system itself, then we'll get into AI's core power, and then see how it's actually applied in both hospital operations and direct patient care, before we wrap up by looking at the crucial role that you are all going to play. So first things first, what does this overloaded system actually look like on the ground? Why is the need for a totally new approach so urgent right now? Well, it's really a two-front battle. On one side, you've got clinicians facing just intense levels of burnout from a mountain of administrative work. And on the other side, the hospital itself is struggling with all these operational bottlenecks. You see it in scheduling, in patient flow, in managing supplies, and all of it leads to delays in care. And these pressures, they don't just affect morale. They directly impact patient outcomes and, frankly, the financial health of our institutions. Okay, so how in the world does AI even begin to tackle such a complex, human-centric problem? Well, it all comes down to one core capability. Its power for pattern recognition on a massive, massive scale. At its very core, AI's power in medicine is its ability to see patterns at a scale that is just impossible for the human brain. It can analyze millions of data points all at once. I'm talking lab results, images, clinical notes, even staffing schedules, and find these really subtle correlations that would otherwise stay completely hidden. And this right here, this frames the relationship perfectly. The goal isn't replacement, it's all about augmentation. All right, so let's move from the concept to some concrete applications. And we'll start with the operational core of the hospital, the place where so many of those administrative burdens actually come from. So where is AI making a real, tangible difference? Well, it's being deployed across the hospital's entire administrative backbone. So instead of just reacting to a full ER, AI can analyze historical data, look at local flu trends, and actually predict bed demand days in advance. It can help create smarter nursing schedules to prevent burnout. It can optimize operating room usage to slash wait times. And it can even automate the supply chain so you don't have critical shortages. The whole goal is to shift the entire system from being constantly reactive to being intelligently proactive. And this is a brilliant real-world example. Operating rooms are incredibly expensive resources. So instead of building more, leading institutions like Cedars-Sinai and Stanford are using AI to analyze their schedules, find those little inefficiencies, and drastically reduce idle time. They're effectively increasing their surgical capacity using the resources they already have, which directly impacts patient access and, you guessed it, the hospital's bottom line. And these operational gains, they translate into significant financial benefits. Studies are showing that optimizing areas like staffing and inventory can reduce a hospital's operational costs by 15 to 20%. In an era of really tight budgets, these savings aren't just numbers on a spreadsheet. They are resources that can be plowed right back into patient care and innovation. Okay, so we've established AI can make the hospital run a lot more smoothly, but how does that operational efficiency translate to the clinical workflow? Let's take a look at how these tools are directly augmenting the clinician right there at the patient's bedside. This data here, it just powerfully illustrates the impact. Instead of a patient waiting over a week, 11 days, for a chest x-ray result because of a backlog, AI can help triage and prioritize, cutting that time to under 3 days. Or look at this, a routine pediatric assessment that took over 8 minutes now takes less than 1. This isn't just about speed, it's about crushing that diagnostic uncertainty and getting critical information to clinicians and patients much, much faster. In this speed, it can lead to proactive, life-saving interventions. For example, Kaiser Permanente uses an AI system that analyzes patient data to predict who is at a high risk of deteriorating, and fast. By alerting the care team hours before a patient might actually crash, this system is credited with preventing over 500 deaths every single year. It's just a crystal clear example of how predictive AI enables proactive care. And now let's bring it full circle, right back to that opening statistic about paperwork. One of the most promising applications is something called the ambient AI scribe. Basically, these tools listen to a patient encounter and automatically draft the clinical note. And as the study shows, the impact on burnout is immediate and it is significant, dropping by over 13 percentage points in just 1 month. This directly attacks a primary driver of burnout, giving physicians back precious time to focus on the patient, not the keyboard. Now, with all this talk of automation and speed, it is absolutely essential that we pause and discuss the limitations of these tools and, maybe more importantly, the irreplaceable role of the clinician. This is always the first question, right? And it's a really important one. But based on everything we see and how these tools are being designed and implemented, the answer is a clear no. The goal isn't to automate the physician out of the process, but to augment their abilities by handling all those data-intensive tasks, freeing them up for critical thinking and actual patient interaction. But we have to be really clear-eyed about the challenges here. AI models are trained on data, and if that data is incomplete or it's unrepresentative, the AI is going to inherit those biases and blind spots. A lot of these systems don't talk to each other, which creates data silos. And some of these models are what we call black boxes, making it hard to understand how they even reached a conclusion. And all of this, it points to the single most important factor, the absolute critical need for physician oversight. And this is the crucial takeaway, and it's just perfectly articulated here. AI is not an oracle delivering some absolute truth. It's a powerful but imperfect tool. And just like any tool, it requires a skilled and critical user. Your clinical judgment is the essential filter. Passive acceptance of an AI's output is simply not an option. Active oversight is mandatory. So let's wrap up by talking about what this all means for you. As you move through your training and into practice, what's your role going to be in this new AI-augmented clinical environment? Your job won't be to code the algorithms. It will be to lead their integration into patient care. So first, you have to understand the tools, what they're good at, and just as importantly, what they're not good at. Second, you have to be that final checkpoint, critically evaluating the AI's output with your clinical judgment. And third, you have to be a champion for responsible use, making sure that these powerful tools are implemented in a way that is fair and benefits every single patient. And, what we've talked about today, optimizing hospital resources, it's really just the beginning. These same AI principles are being applied to even more exciting frontiers, from accelerating the diagnosis of rare diseases to creating truly personalized medicine, which we'll get into in our next module. But this incredible potential brings with it an equally great responsibility. As we've seen, AI can optimize our hospitals and accelerate care, but it also presents new challenges and requires constant human oversight. And that really leaves us with the critical question for the future of medicine. Now that we see the benefits, how do we as clinicians manage the risks? All right, welcome back, everyone. So in our last lecture, we really honed in on how AI can help diagnose a single patient, right? Looking at that one set of scans, that one EKG. Today, we're pulling the camera way, way back. We're zooming out to see how AI is being used to manage the health of an entire hospital system, and even how it can help predict major public health crises. We're shifting our focus from the individual to the whole system. So here's our game plan for today. First, we're going to diagnose the problem, the incredible pressure our healthcare systems are under. Then, we'll dive into the AI-powered solutions, starting right at the ER front line, moving to virtual care, and even looking at how we can predict the next outbreak. And we'll finish up with what I think is the most crucial part, your role as a future doctor in this totally new landscape. So, let's jump in. Before we can really appreciate the solutions, we have to understand the problem. And the problem is that our healthcare system is under some serious strain. You can almost think of it as having these deep cracks in its foundation. We're going to see how AI isn't just about patching those cracks, but about reinforcing the entire structure. And that pressure, it starts the moment a patient walks through the hospital doors. This quote from ER Triage really says it all. Triage in the emergency department isn't just about making a queue. It's an incredibly high-stakes sorting problem. One wrong call can set off a dangerous domino effect, delaying care for someone who's critically ill and, at the same time, wasting precious resources on someone who is less urgent. Now, this pressure isn't just at the front door. It follows clinicians around all day. I mean, this image really captures it perfectly, the crushing weight of all that documentation. And let's be clear, this isn't just paperwork. It is a primary driver of burnout. Every single minute spent typing on a computer is a minute you're not spending with a patient. And that erodes not just time, but morale, right, across the entire system. Okay, so we've laid out some of the problems. Now let's start talking about the solutions. We're going to go right back to that chaotic entrance of the emergency department and see how AI can start to bring a little bit of order to the madness. This slide really shows the fundamental change. On the left, you've got the old way, right? A clinician, under immense pressure, relying on their experience and heuristics, which are basically quick mental shortcuts. It works, but it can be subjective. Now look at the right. This is where AI just changes the game. It's not making a gut call. It's performing a super fast, data-driven analysis, pulling in 50 to 60 different data points in seconds to suggest a whole care pathway. So how does this actually work in the real world? Well, let's take that ER triage system. First, it just drinks in all the patient data, vitals, history, lab results. Step 2, it crunches all of that data, comparing it against established clinical scales. These are basically proven scoring systems for risk. And then step 3, in less than a minute, it spits out a clear recommendation. It's not replacing the doctor, it's empowering them with this incredibly powerful, evidence-based second opinion right when they need it most. Now, AI's impact isn't just stuck inside the hospital walls. It's also fueling a massive revolution in virtual care. And it's completely changing how patients and providers interact with each other. The engine driving this whole revolution is something called natural language processing, or NLP. The easiest way to think about it is this. NLP is the technology that lets AI become fluent in human. It's the magic that allows a machine to actually listen to a patient describe their symptoms, understand the context and the meaning, and then respond with medically sound advice in just plain, simple language. And what this creates is a huge win-win. For patients, it's kind of like having a personal health assistant on call 24/7. It can help with symptom checking, give you medication reminders. It's amazing. And for us, for providers, it's an incredibly powerful tool that can scan through years of clinical notes in seconds to give you a perfect summary of a patient's history. This frees up so much of our cognitive bandwidth, letting us focus on the complex decisions that really require our human expertise. So we've seen AI helping one patient at a time and helping one clinician at a time. But what happens when we apply that same data crunching power to an entire population? Well, that's where AI is absolutely transforming public health and, believe it or not, our ability to predict the next big disease outbreak. This table really says it all, doesn't it? Traditional public health surveillance, it's like reading yesterday's newspaper. It's reactive, it tells you what already happened. AI-powered surveillance, on the other hand, is predictive. It's analyzing real-time data from news reports, social media, even airline flight patterns to forecast where a disease might be headed next. It is literally the difference between reporting on the rain and forecasting the hurricane. Okay, let's pull our focus back inside the hospital again, because AI's role isn't just clinical, it's also operational. It's helping to solve the unbelievably complex logistical puzzle of just running a modern medical center day to day. Think about it. A hospital is just this constant flow of people and resources. And as this chart shows, AI can help optimize all of it. By predicting admissions and discharges, it can make sure beds are available. By forecasting a surge in flu cases, it helps with staff scheduling so you're not caught short-handed. It can even predict when an MRI machine needs maintenance before it breaks down. This is like the invisible nervous system of a smarter, more efficient hospital. And that brings us to our last and honestly our most important section. We've seen just how powerful these AI tools can be. But at the end of the day, they're just that, tools. Their ultimate value, and more importantly, their safety, depends completely on the wisdom and the critical oversight of the human expert. It depends on you. So the big question is, are these systems a perfect solution? The answer, and I want to be very clear about this, is a hard no. And for you as future clinicians, understanding their limitations is every bit as important as understanding their power. As the slide lays out, we have to be vigilant. First, let's talk about data set bias. An AI is only as good as the data you train it on. So if that data underrepresents a certain group of people, the tool might make really dangerous errors for those patients. Then there's the black box problem. This is where the AI gives you the right answer, but we have no idea how it got there. For clinical safety, that's just not acceptable. And this is why physician oversight is absolutely non-negotiable. I want you to remember this. These tools are here to support your decisions. They never, ever replace them. The final call is always yours. As you all move forward in your careers, you are going to be the generation that truly weaves AI into the fabric of medicine. Your job won't just be to use these new tools. Your responsibility will be to understand them deeply, to question them constantly, and to serve as the ethical guides for how they are implemented in your hospitals and clinics. So I'm going to leave you with this question to think about. As you step into your future roles, how are you going to champion the safe, the effective, and the equitable use of this technology? Because making sure that these amazing tools benefit every single patient, that is the ultimate goal. In our next explainer, we'll continue this by exploring more of those benefits across all of medicine. Thanks so much. All right, everyone, welcome. So in our last discussion, we took that really high-level, big-picture view of AI and health systems. Now, for Module 5, we're going to bring it right down to the clinic, to the bedside, and see how AI is directly changing the way we practice as clinicians. So here's our game plan. We're going to start with the why AI is even necessary in the first place. Then we'll get into the specifics of how it's helping us, from making better diagnoses to, and this is a big one, tackling that mountain of administrative work we all know and love. Okay, first things first, let's really nail down the core problem that AI is here to solve. And honestly, it's a huge one. It's the absolutely staggering amount of medical information that we are somehow expected to know, retain, and apply every single day. I love this quote because it just hits the nail on the head. It's not just that there's more information now. The key phrase here is inflection point. We've fundamentally passed the limit of what a single human mind can handle on its own. We've literally hit a cognitive ceiling. And if you want to understand the speed of this change, look at this. Back in 1950, it took about 50 years, half a century, for medical knowledge to double. 50 years. Today, it's a matter of months. That gap between what we can possibly know and what's out there to be known, well, it's growing faster than any of us can keep up with. Now, when you hear about this information overload, it's natural to feel some anxiety, right? This idea that technology is coming to replace us. But that is absolutely the wrong way to think about it. This is a clear case for augmentation, not replacement. The right framework here is what we call augmented intelligence, or sometimes hybrid intelligence. The key word is partnership. This isn't about AI taking over. It's about AI serving as our co-pilot, making us better at what we do. And this is the critical distinction. In this augmentation model, we let the AI do what it's built for, sifting through enormous amounts of data, finding patterns we could never see. But the final, most important parts, the clinical judgment, the empathy, the accountability, that stays with us. That remains human. So what does this partnership look like in the real world? Well, let's take a look at one of the areas where AI is already having a massive impact: medical imaging. You know, these AI models, especially the deep learning ones, they can be trained on literally millions of scans. And by doing that, they learn to spot these incredibly subtle patterns, things that might be invisible to the human eye, and they do it with incredible speed. And this isn't just theory. Look at the numbers. These are real-world results. We're talking about identifying lung nodules 26% faster, missing 29% fewer of them. For our patients, this isn't just a number. This means catching cancer earlier, and that can change everything. Okay, so beyond just diagnostics, AI is really the engine that's pushing us toward truly personalized medicine. You might hear it called the 4P model, which just means making healthcare more predictive, preventative, personalized, and participatory. The process is pretty amazing. You take all this different data, a patient's genomics, their EHR history, their scans, their labs, everything, and you feed it to an AI. The AI can then find patterns and help predict how that one specific person will respond to a certain treatment. We're finally starting to move past that one-size-fits-all model of medicine. And it goes even further than that. AI is completely changing how we even develop new drugs. It can speed up the process of finding targets, screen molecules automatically. I mean, it is dramatically cutting down the time and the astronomical cost of bringing new life-saving medicines to the people who need them. All right, now for something I think we can all get excited about. One of the most immediate, tangible benefits of AI is its ability to fight a huge cause of clinician burnout, the soul-crushing administrative burden. And the problem is bad. I mean, really bad. A major study found that over half, more than 50% of clinicians in outpatient settings were reporting symptoms of burnout. And a huge driver of that is all the clerical work that pulls us away from actually caring for patients. I don't need to tell you what these are. You know them. The endless hours typing notes into the EHR, the battles with prior authorizations, the overflowing inbox of patient messages. It's exhausting, and it's not why we went into medicine. So one of the coolest solutions emerging is something called an ambient AI scribe. Imagine this. It just listens to the natural conversation you're having with your patient, and in the background, it automatically transcribes and summarizes everything into a perfect clinical note. It lets you actually look at your patient again. And the data on this is just incredible. That same study found that after just 30 days of using these tools, clinicians had 74% lower odds feeling burnt out. The rate plummeted from over 51% to under 39%. That is a massive, meaningful change in our quality of life at work. So let's pull all this together. When you think about managing information overload, getting better diagnostic tools, and getting rid of burnout, all of it points to a pretty fundamental shift in what it means to be a physician. You know, your value in the future won't be about how many facts you can memorize. It's going to be about your skill as an interpreter, your ability to take these insights from an AI, critically evaluate them, and apply them with wisdom and empathy. You become the essential human in the loop. And this quote just reframes everything perfectly. With the data explosion we talked about, the question isn't, will AI replace us anymore? The real question is, can we even practice safe, modern medicine without AI? It's becoming an essential tool. Which leads to the big question for all of you. As you get ready to enter this new world of medicine, what's the single most important skill that you need to be working on? And here's the answer. It's being able to use these incredibly powerful tools wisely. Because here's the thing. You can't use a tool effectively if you don't have a deep, critical awareness of its weaknesses, its biases, and all the ways it can go wrong. And that perfectly sets us up for our next discussion. Because after seeing all the amazing benefits, we have to look at the other side of the coin. So next time, we're going to dive deep into that crucial topic, the limitations and risks of AI in medicine. Thanks, and I'll see you then.